the federal government will reopen HealthCare.Gov. This is thanks to an executive order signed by President Biden, working with the Centers for Medicare and Medicaid Services, understanding that the COVID pandemic presents exceptional circumstances for consumers needing access to health insurance. The new special enrollment period will run February 15th through May 15th, 2021. And this is for the 36 states that use the federally facilitated marketplace. Now, in some early guidance coming from the Centers for Medicare and Medicaid Services, they clarify that consumers can visit HealthCare.Gov to submit a new application or update an existing application. CMS will conduct an outreach campaign, they say. They'll work with community and stakeholder organizations focused on education and awareness of this new opportunity and the timelines. They plan to spend about $50 million on outreach and education. Consumers who are eligible and enroll under this new special enrollment period will be able to select a plan with coverage that starts prospectively the first of the month after plan selection. Now, consumers will have 30 days after they submit their application to choose a plan. They're going to want to do that quite quickly, especially as you start butting up against the end of the month. You could have a plan selection that happens on the last day of a month, and then your new coverage could begin the first of the next month. So it could happen quite quickly to get individuals connected to coverage. Current enrollees will be able to switch plans, and consumers won't be asked to provide additional documentation of qualifying life events. Typically, in a special enrollment period, if you lost your job or had a child, you would have to provide verification of that. That will not be required in this special enrollment opportunity. It's because it looks a little bit more like a traditional open enrollment period, only running a lot longer. Now, some consumers may already be eligible for other existing special enrollment periods or Medicaid program even before this February 15th date starts. So you can visit HealthCare.Gov now to find out if you can enroll even before that February 15th to May 15th window. Again, like we said, this is for the 36 states that use that federally facilitated marketplace on HealthCare.Gov. In the memo from CMS, they strongly encourage states operating their own marketplace platforms to make a similar enrollment opportunity available to consumers in their state. And we've already heard that some states plan to do that. In this same executive order, there was a lot more than just creating this open enrollment opportunity for HealthCare.Gov. It also directed federal agencies to re-examine policies that undermine protections for people with pre-existing conditions across the board, including people that have pre-existing conditions such as complications from COVID. It also instructs agencies to look at demonstration waivers, especially those that include work requirements or other provisions that may reduce coverage or undermine enrollment in Medicaid. It also wants federal agencies to look at any policy that would make it hard to get connected to a Medicaid program. Now, the purpose of this order, the announcement of this order, lists the commitment of the administration to protect and build on the Affordable Care Act, to meet the healthcare needs created by the pandemic, to reduce healthcare costs, to protect access to reproductive healthcare, and make our healthcare system easier to navigate and more equitable. In the description below, we give you the link to HealthCare.Gov. Remember, the new special enrollment period runs February 15th through May 15th, 2021. You can also read that executive order, and we also share with you the memo from the White House giving a little bit more detail. Now, more guidance is expected in the days ahead from the Centers for Medicare and Medicaid Services, providing even more clarity to how this new special enrollment period will work. We will keep you posted on this channel.